Hello everyone, now let us discuss about anatomy of endocrine glands part 2. In the current session, we will be discussing about posterior pituitary. Although the posterior pituitary or neurohypophysis. In the previous session, we have discussed that posterior pituitary is also called as neurohypophysis and it is composed mostly of nerve tissue. The posterior pituitary does not synthesize any hormones. This is important point. Posterior pituitary does not synthesize hormones. It does store and release two hormones. They are oxytocin and antidiuretic hormone. And it consists of axons and axon terminals of more than 10,000 hypothalamic neurosecretory cells. And the cell bodies of the neurosecretory cells are in the paraventricular and supraoptic nuclei of the hypothalamus. Their axons form the hypothalamo-hypophyseal tract. And this tract, it begins in the hypothalamus and ends near the blood capillaries in the posterior pituitary. The neuronal cell bodies. Posterior pituitary does not synthesize any hormones, but the neuronal cell bodies of both the paraventricular and the supraoptic nuclei synthesize the hormones oxytocin and antidiuretic hormone. Antidiuretic hormone is also called as vasopressin. And the axon terminals in the posterior pituitary are associated with specialized neuralgia called as pituitarites. And these cells have a supporting role similar to that of astrocytes. After their production in the cell bodies of the neurosecretory cells, oxytocin and antidiuretic hormone are packed into the secretory vesicles, which move by fast axonal transport to the axon terminals in the posterior pituitary, where they are stored until nerve impulses trigger exocytosis and release of the hormone. And the blood is supplied to the posterior pituitary by the inferior hypophyseal arteries. Inferior hypophyseal arteries supply blood to posterior pituitary, which branch from the internal carotid artery. And in the posterior pituitary, the inferior hypophyseal arteries drain into capillary plexus of the infundibulum process, a capillary network that receives secreted oxytocin and the diuretic hormone. And from this plexus, the hormone pass into the posterior hypophyseal veins for distribution to target cells in other tissues. Here you can see this is the hypothalamus and this is the pituitary gland. This is the infundibulum, this is hypothalamus. These are the cell bodies of the neurosecretory cells. And these are the axons of the neurosecretory cells, that is hypothalamo-hypophyseal tract. This is the hypothalamo-hypophyseal tract. This is the axon terminal. If you see, these are the capillary plexus of the posterior pituitary. Coming to the hypothalamo-hypophyseal tract, the axons of the hypothalamic neurosecretory cells form the hypothalamo-hypophyseal tract, which extends from the paraventricular and supraoptic nuclei to the posterior pituitary. And the hormone molecules synthesized in the cell body of the neurosecretory cells are packed into secretory vesicles that move down to the axon terminals. And the nerve impulses trigger, whenever the nerve impulses trigger exocytosis of these vesicles, then the hormones are released. First, coming to oxytocin. During and after the delivery of a baby, oxytocin affects two target tissues. The first is mother's uterus and the next is breast. During the delivery, stretching of the cervix of the uterus stimulates the release of oxytocin, which in turn enhances the contraction of the smooth muscle cells in the walls of the uterus. And after delivery, it stimulates the milk ejection, that is let down from the mammary glands in response to the mechanical stimulus provided by a suckling infant. The next hormone is antidiuretic hormone. As its name implies, an antidiuretic. Anti means against, dia means throughout, Diuresis means urination, is a substance that decreases the urine production. ADH causes the kidneys to return more water to the blood, thus decreasing the urine volume. And in the absence of ADH, urine output increases more than 10 folds. That is from normal 1 to 2 liters to about 20 liters a day. And drinking alcohol often causes frequent and copious urination because alcohol inhibits the secretion of antidiuretic hormone. ADH also decreases the water loss through sweating and causes the constriction of arterioles, which increases the blood pressure. And this hormone's other name is vasopressin. It reflects its effect on the blood pressure. The amount of ADH secreted varies with blood osmotic pressure and blood volume. In the next following figure, it shows the regulation of ADH secretion and the actions of ADH. The first point is high blood osmotic pressure or decreased blood volume. High blood osmotic pressure or decreased blood volume due to dehydration or a decline in the blood volume because of hemorrhage, diarrhea, or excessive sweating. It stimulates the osmoreceptors and neurons in the hypothalamus that monitor the blood osmotic pressure. Osmoreceptors are the neurons in the hypothalamus that monitor the blood osmotic pressure. Elevated blood osmotic pressure activates the osmoreceptors directly, and they also receive excitatory input from other brain areas where blood volume decreases. And the osmoreceptors activate the hypothalamic neurosecretory cells that synthesize and release the ADH. And when the neurosecretory cells receive excitatory input from the osmoreceptors, they generate nerve impulses that cause exocytosis of ADH containing vesicles from their axon terminals in the posterior pituitary. This liberates ADH, which diffuses into blood capillaries of the posterior pituitary. The blood carries ADH to 3 target tissues. The first one is kidneys, the next is sweat glands, and finally smooth muscle of the blood vessel walls. The kidneys respond by retaining more volume, which decreases the urine output, and the secretory activity of sweat glands decreases, which lowers the rate of water loss by the perspiration from the skin. And finally, smooth muscles in the walls of the arterioles contract. The smooth muscles contract in response to high levels of ADH, which constricts the lumen of these blood vessels and increases the blood pressure. Urine output is decreased, sweat production is decreased, and blood pressure is increased. These are the 3 actions of ADH. In contrast, the low osmotic blood pressure or increased blood volume inhibits the osmoreceptors, and the inhibition of osmoreceptors reduces or stops ADH secretion. And the kidneys retain less water by forming a large volume of urine. Secretory activities of sweat glands increases and arterioles dilate. And the blood volume and osmotic pressure of body fluids returns to normal. Here you can see this is the schematic representation. First is if high blood osmotic pressure is present, it stimulates the osmoreceptors. These osmoreceptors, they activate the neurosecretory cells. They activate the neurosecretory cells that synthesize and release the ADH. And simultaneously nerve impulses liberate the ADH from the axon terminals. This is the axon terminal, and the nerve impulses liberate the ADH from the axon terminals into the posterior pituitary, and from posterior pituitary into the bloodstream. And the target tissues are kidneys, sweat glands, and arterioles. The action on kidneys is kidneys retain more water, which decreases the urine output. Sweat glands, they decrease the water loss by perspiration from the skin, and arterioles constrict, which increases the blood pressure. In contrast, if low blood osmotic pressure is present, it inhibits the osmoreceptors. Here it is indicated by red color. Inhibition of osmoreceptors takes place when low blood osmotic pressure is seen. And inhibition of phosphoreceptors reduces or stops the ADH secretion. And secretion of ADH can also be altered in other ways. They can be pain, stress, trauma, anxiety, acetylcholine, nicotine, drugs such as morphine, tranquilizers, and some anesthetics. They stimulate the ADH release or secretion. In contrast, dehydrating effect of alcohol, which has already mentioned, may cause both the thirst and headache typical of a hangover. And this alcohol, it inhibits the ADH secretion. And hyposecretion of ADH or non-functional ADH receptors cause diabetes insipidus. Hyposecretion of ADH or non-functional ADH receptors cause diabetes insipidus. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.